All right, as folks continue to come in, I'll give you a quick logistics overview since that's not news for many of us at this point. Welcome and good morning. We're so pleased to have you here at the Inter-Association Wellbeing Research webinar. I'm Erin O'Sullivan. I'm the Director of Advocacy and Strategic Partnerships with NIRSA. A couple quick highlights. This webinar is being recorded. It will be posted in the next several days to NIRSA's YouTube channel, and then that link will be shared with our partner associations who can distribute it to their memberships through their own channels, so you can look out for that. As I'm sure you're familiar, we have the chat feature. We encourage you to use that to have conversation. If the presentation says something that reminds you of a situation you dealt with on your campus or sparks a question or idea, please reflect on that. That's a great way to be networking and learning from each other. And of course, we have the Q&A function. And so please do insert your questions there throughout the presentation so that we can get to those and have a little bit of interaction that way as well. And with that said, I will turn it over to my friend from NASPA, David Arnold, and off we go.
Well, good morning, folks. Welcome to today's conversation. My name is David Arnold. Erin, thanks for that introduction. And I serve as the Assistant Vice President for Health, Safety, and Wellbeing Initiatives with NASPA. For those of you not aware, NASPA is a membership association that serves folks in student affairs roles, from Vice President of Student Affairs to practitioners at the beginnings of their career. I'm here to kick off our conversation by just setting some foundation about what brought us here to the point of having some research around well-being. Back in 2018, NIRSA, NASPA, and ACHA convened to start having some discussions about how we as associations could be working together and working together effectively to support college and university professionals who are working into a new space of well-being. Now, well-being itself isn't very new, but the conversation in higher education has evolved a little bit from thinking about this as simply having enough hydration and nutrition available on campus to a broader design base of how we actually think about our campuses, their structure, and their systems to support the health and well-being of students. Throughout 2018, 2019, 2020, we gathered professionals together. We provided full member surveys, and we increased the number of folks who participated in the inter-association collaboration to discuss and clarify this commitment to our membership. That included two very important place-based convenings of professionals to help us get a sense of what we were saying to the world well-being was and have a deeper understanding. Simultaneously, NASPA, NIRSA, and ACHA had all made a commitment to the field that we would sponsor some research to deepen the understanding and advance the commitment to well-being that we as associations felt was deserved to the field. And we did this through the identification of a sponsored research project. After a selective search, we resulted in identifying today's presenter. And this was really exciting for us because we really wanted to deepen this connection and to have some really outcomes associated with this collaboration. But most of you on the call will be aware that in 2020, something else happened that introduced a little bit of conflict into the selection and administration of this. So while we certainly would have been a little bit expectant to have done this presentation back in 2020, while we were all dealing with that, and Dr. Griffin was getting his research completed during the middle of a global pandemic, we had a couple of challenges that I look forward to hearing about today as part of your presentation, Micah. So without further ado, I'm going to pass it over to Dr. Micah Griffin, who is the Senior Director of Health Services at Pennsylvania State University. Micah, thank you so much for sharing your time and the results of your research with everyone on today's call.
Yes, sir. Yes, sir. Thank you so much, David, to NASPA, to NIRSA, and of course, to ACHA, American College Health Association. Thank you all so much just for this opportunity and for the willingness to support something I think we all can agree has become very important over these past 2 years. It was always important to us if you're a college health and well-being professional, but now those that are outside of this health space are starting to get really an understanding and insight into not just the importance of well-being, but I think the value that it adds to supporting our students, especially during something as serious and as impactful as the COVID-19 pandemic that we've experienced over these past 2 years. So thank you all so much for just supporting this. And like you mentioned, that wasn't the original intent. I think when the call to action went out, there wasn't a pandemic. But of course, that quickly shifted, I think, over the next few months, as I'll kind of talk through today. We had to pivot. Essentially, I think something that we all had to do over these past 2 years was pivot at some point in our lives. And, I think the impact, the design, the actual delivery and implementation of this project was all impacted by that and had to do just that. It pivoted. But something I will say that I gained throughout this process was just, I think, not only the resiliency, but just the overall value that college health and well-being professionals have. As you all know, if you work in this space, we've been tasked with supporting our students' health and well-being throughout. And the pandemic, I think, just heightened that. So I really want to make sure I give a shout out to all of those City University of New York, CUNY, my former colleagues throughout the CUNY system, who definitely made this research and this CUNY WELL framework. They made it possible. Having the opportunity to engage with them pre-pandemic when I was first recruiting for the study, and then being able to engage them virtually, of course, during the pandemic, and just to hear, their experiences and perceptions of how they had to engage and pivot and take care of our students, especially in a dense urban environment like New York City. So really just want to make sure I give them a shout out. But thank you all again for just taking this opportunity, those that are in the collaborating organizations and those that are joining us today. I'm so excited to share this CUNY WELL framework, as well as to give you all some recommendations and best practices and overall ideas that I think that you can use to impact health and well-being on your campus. And that's what I really want to focus on today. Is I'm definitely going to discuss, how we got to this point, some background information, what the research was grounded in, my data collection and analysis methods. But I really want to make sure I spend a lot of time on the actual recommendations part and the actual framework, right? Because I think we're all tasked with a million things that we're doing every day. So I think what I really want you all to leave with and really gain from this conversation is ways that you can take elements that I've learned and things that we gained through developing this framework and really apply them to your campus structures and your campus communities. And as you'll see from the presentation slide here today, the basis of this framework was really to understand how we integrate this well-being, this overall idea of well-being, specifically in the campus health services across a multi-campus system. So for those that don't know, CUNY, or the City University of New York, is a dense urban environment campus. It's a multi-campus system, which means that there's a central office situated in Manhattan, which is governed by a chancellor and several other senior leaders, but they essentially create the direction and the policy and the ideas, and they distribute them out to the campuses across this system. In this system is made up of 25 campuses, and they're all unique. They're all spread out across the city of New York, and they range in everything from 2-year community colleges, 4-year bachelor's or senior colleges, as they refer to them in the CUNY system, and then professional schools or graduate schools that house our master's and our PhD and doctoral programs. So just to kind of give you some context, CUNY is a very diverse and it's a very large system that has about 275,000 students across all 5 boroughs in New York City. So it's a very dense, a very urban, and a very diverse environment, which I think was almost the ideal campus community for this type of study, because it allowed me to have conversations with healthcare professionals that were serving students across all of those campuses. And for those that aren't familiar with New York City, the southern part of Brooklyn is completely different than the northern part of Manhattan or Harlem, or even Queens or the Bronx. So depending on what part of New York City you're in, it could play a completely different world. And I think that was ideal and added value to this study, because it allowed us to really see the impact that health and well-being has on a different group and a diverse range of students. So again, that's just the context of this study. And like I said, the idea around it with the recommendations excuse me, are for college health professionals who work at multi-campus systems, because there's so many across the country, from the UNC system in North Carolina, the California State system, the SUNY system, which is the State University of New York. I know CUNY, City University, CUNY, SUNY, State University, SUNY, New York. You just do things different. But that's just the idea behind this particular study, and it really focuses on health professionals that are at multi-campus systems. But again, when I get to the framework and we discuss the implementation part, I really want to drive home that these ideas or these principles can be implemented across any campus or university, regardless of the size, scope, location, whether it's across a multi-campus system or not. So let's dive into it. So what does your campus culture say? And essentially, I took some data from what we found in this study, along with my literature review. And these are some statistics that we came up with. And I really wanted to put these first because I think it really sets the foundation for a lot of elements of this framework. So what does your campus culture say? Like thinking about your campus right now, whether it was pre-pandemic, during the pandemic, which we're still in, or even currently to this day, what would you say was the biggest impact that your students felt this year? I think most of us will lean towards mental health as being one of the most impactful things, or lack of access, or even just the effects of the pandemic. But from this study, we found out, and not just this particular study, but there were some other studies that are done through CUNY School of Public Health, which actually focus on student well-being as well. And I'll talk about that in a little bit. But some data that came out from that was 60% of CUNY students said that their ability to do schoolwork had decreased, partially because of their health or the health of a family member. And this was taken during the pandemic. So over half of those 275,000 students that I mentioned that go to CUNY schools, more than half said that their ability to do schoolwork had decreased, either because of their health being impacted by COVID or the health of a family member. And I think that's extremely important because as students have come back to campus this semester, as they're re-engaging in those return to normal activities, this is something that is still in their mind. And some of these students actually lost family members to COVID, had experienced COVID themselves, has caught COVID since they returned to campus, and has really been impacted. And as you know, being in quarantine and isolation, some campuses don't allow students to still have access to their academic studies. So this is something that's very important as we focus on how we impact and talk about well-being for our students. And I really want you to think about that for your particular campus. What would your campus say, or what would students on your campus say about their ability to do schoolwork over these past years? How many requests for withdrawals have you had on campus? How many students have come and engaged your counseling centers on campus? Like, has utilization going up? What are some of those main things that your counselors or your behavioral health professionals are seeing? I think that's something really important to focus on. This is another statistic that came from ACHA, the American College Health Association. And this was captured during one of their national surveys, where 51% of students nationwide believe health and well-being are a priority on their campus. And this was taken pre-pandemic. So I think it'll be interesting to see now that our students have experienced a year of remote work, and now they're going into a second semester of on-campus engagement during the pandemic. It'll probably be interesting to see what they say about your campus and how much of a priority health and well-being is. But this is something that's really, I think, important to know, because we as health professionals, we can have these grand and glorious ideas. We can talk about all of these frameworks and studies and white papers and implementation and this data this and this data that and this outcome this. But if your students don't believe the things that you're saying and it's not impacting their health outcomes or their positive experiences on campus, none of that even matters. And I think that's something in developing these resources, because if only half, a little bit less than half of students across the country believe that health and well-being are a priority, that means the other half don't. So what is the priority on your campus? And depending on what athletic conference you're in, some might say football, basketball, fraternity, sorority life. What's the priority on your campus if over half of students across the country don't believe that health and well-being is a priority? So let's get into like CUNY WELL and the foundation of it and how it came about, the process, how we collected data, who was involved. So essentially the idea behind CUNY WELL on my research study was, like I said, was for us to really find out from the perception of healthcare professionals that currently work in this space, what are some of the things that you're seeing that you would like from this main central office? Because like I mentioned earlier, the way the CUNY is made up, there's 25 campuses spread across the boroughs in New York City. And if you go to California, there's campuses spread across the state. In North Carolina, the same thing. And each one of these campuses tend to have unique populations. But at the end of the day, if there is no central recommendation, no process, no procedure, no framework, no guidelines for how you deliver healthcare services, or how you deliver health and well-being services, whether it's in counseling, student health, campus rec, health promotion, and essentially those campuses are all doing different things. And I think that's something important to focus on, is when we go about delivering services or understanding our student body, how does one campus connect to the other? And that's essentially what we found out during our research and during our data collection, was that there was no integrated model across the CUNY system for supporting student health and well-being. And when we look at other systems across the country, there have been recommendations that have come out. There have been studies, But as far as a process, a policy, or a central framework or model that comes down from a central office that is guided by principles that impact all of the students, there was very little to no processes or frameworks that are supported or in place when you look at the various systems across the country, and not just CUNY. When we look at the University of Texas system, the UNC system, University of Florida, any state you choose that has a multi-campus system, you will probably be hard pressed to find a centralized process or framework for supporting our recommendations that guide how health services delivered on those campuses. So that was essentially the idea behind doing this. And we sought to engage with CUNY staff. So student health directors, health promotion managers, counselors, social workers, case managers, all of those individuals that engaged in some point or had some involvement in student health and well-being outcomes was involved in this study. So this resulted in one-on-one semi-structured interviews where 11 CUNY staff members were involved. And before the pandemic, the idea was for us to actually go to campus. So not only were we going to engage and have conversations with these professionals, but we also wanted to get a perception of how the health services and the well-being departments and units were set up. If the pandemic wouldn't happen, we would have engaged in person, and we would not only would have had an understanding from individual perception, but we also would have been able to draw conclusions and generate big descriptions from engaging and looking at how the services were delivered and how the organization was set up, right? Because when you think about a campus as a community, where your student health center or your counseling center is located on campus will most certainly have an impact on how involved or how utilization is viewed and impacted from students. Because if it's not centrally located, if it's in a difficult place to get to, if it's not well lit, if there's not proper ventilation, if there aren't services that are available during a timely manner when students will access it, utilization is going to go down. So that was something that we wanted to do, of course, before the pandemic, but we had to shift. So all of our individual one-on-one interviews were conducted virtually via Zoom, and they were scheduled for an hour. And we asked questions with everything from challenges to resources to what collaborations to even defining your service, right? Like, is your health center integrated with your counseling center? What are the hours? And then, of course, a pivot that we made from the original grounding ideas or interview questions was to, of course, add a question about COVID-19, because you can't have a conversation about college health and well-being right now, or even in the future, without considering the impact that COVID-19 or just infectious diseases in general have on students. So we included a question about the impact of COVID-19 and what it's had, the impact it's had on student mental, physical and emotional well-being. And again, these were, we actually examined 25 health and well-being programs across the city, University of New York. So again, because we weren't able to physically go to these spaces during the pandemic, we actually viewed their websites and looked at data, looked at social media accounts. So we almost did kind of a virtual tour, because if you look at how a student health and well-being unit is presented or displayed virtually, that gives you just as much of an impression of how that unit was displayed or integrated on campus. So that was very important. And I think that's something as well, when you're looking at how you're presented on social media, it's something important to think about when you're developing these services. So again, the way our research was collected was we did 1 hour semi-structured interviews one-on-one with different healthcare professionals across the city university. And again, these range in everything from health center directors, counseling center directors, campus nurses. Then we also had 2 health promotion directors in there as well. So a nice mix of different college health and well-being professionals. And this data was collected during the months of May through September of 2020. So right in the middle of the pandemic. And these were the research questions right here. I'm not going to read through these because I do want to make sure we leave some time for us to have a conversation and have a Q&A. But you can see here the research questions that essentially guided this study. And these research questions actually supported the interview questions that we actually asked the participants. And these were all based in, of course, a thorough literature review where we extensively looked at, of course, all of the data and research that's come out from the partnering organizations. So things that NASPA has put out, of course, ACHA, and of course, NIRSA in the recreation and wellness space, all grounded the idea around developing these research questions that you see on the screen here. So let's get into the framework. So from collecting our data, we actually recorded the data and it was transcribed, and we use In Vivo as a transcription qualitative software. So again, I guess I should have started in the beginning. This was a qualitative study. Sorry, the researcher and me completely skipped over that. So this was a qualitative study where essentially we collected the data. We had conversations one-on-one with participants, and that data was then transcribed into text. And then we use in vivo as a qualitative transcription software where we were able to draw themes from the conversations that we had. And essentially this framework was developed based off of those themes or those similarities that were discovered from the conversations with our 11 CUNY staff members. So let's get into this framework. I think this is the most important thing about this entire conversation. So from that data collection and transcribing and interpreting that data and comparing those themes and those nodes and drawing those out, these are the 6 essential principles that came out from those conversations, from the one-on-one conversations, from the literature review, and also from observing and looking at how those different units across CUNY were presented online. And these are the 6 principles that I think would guide us or set the foundation for how you can effectively, from a peer review standpoint, integrate health and well-being as not only an idea, but a practice that results in positive outcomes for your students on your campus. And essentially, as you'll see here, the theme was that the Student Health Center essentially serves as that anchor or that foundation for where all of these ideas are not necessarily generated, but serve as that connector to all of the pieces in your health and well-being portfolios. So data-driven term-based clinical care was very important because I think this essentially guides what we're talking about with students that have experienced COVID or those that just need that one-on-one term-based care, which is essentially delivered through your student health centers. And it has to be data-driven, and notice I put term-based in there because I think that's something that's important, and what we've discovered on a higher level during this pandemic was that our clinical care has to be term-based, right? Like student health centers are not designed as urgent care or long-term care facilities. They're essentially designed to treat, diagnose, prescribe, and follow up. And if there is a need for a high level of care, there should be stronger collaborations, as I'll talk about a little bit, student-centered, where these students can be referred out, right? Because student health centers have a capacity. And I think what we determined or found out during COVID was that those student health centers can be pushed to capacity, just like we're seeing with essentially the healthcare system across the country right now. Strategies to influence campus policy was discovered as well, because I think what the pandemic showed us and what our participants responded was that there wasn't a strong campus policy around health and well-being. There's campus policies on donations, foundations, there's campus policy on the bursar and grades and withdrawals and academic discipline and graduation. But when you really look at your policies, right, not your student health center policies or your counseling center policies, your university policies, right, that are at the highest level that govern campus policy. How many policies exist, would you say, that are centered around health and well-being? I'll pause for a few seconds to see if anybody wants to put those numbers in the chat box or respond or pose that, or just think about it. Think about the policies that exist on your campus. How many of those are grounded or shaped or influence health or wellness on campus? Maybe a little bit more now because of COVID, but prior COVID, most campuses would probably say 0 to none from a campus policy standpoint. So this is extremely important that there are leaders on campus that can influence campus policy and help shape campus policy and oftentimes write it and make sure that it's implemented and it governs what we do. The 2 items that I'm going to dig a little bit deeper into, because these demonstrated the biggest return, meaning that when we had these one-on-one conversations and when we did our literature review and just examined the campus representation online, advocacy, education, and outreach, which is the 3rd pillar you see right here, 3rd principle, and decisions rooted in health equity were the main 2 pieces that stuck out the most. So I'm going to do a little bit deeper dive into those in a second, but I wanted to make sure I hit on each one of the principles on here, so that way we can generate a rich discussion, or if there are any discussions or further feedback from these principles, I would love to hear those. So advocacy, education, and outreach, or AEO, as I deemed it, because I'm just like that acronym. It sounds good too. Just AEO. Doesn't that sound good? Like AEO. You can feel free to use that. I don't have no trademark on that, but AEO, advocacy, education, and outreach are huge. I mean, if I can say one of the most important principles on here, they're all important, but if I had to pinpoint maybe the most important one, it would definitely be advocacy, education, and outreach as a central foundation for where your work should start. You have to be an advocate, not just for resources on campus, because as we know, health and well-being, according to the data, only half of students believe it's a priority. So I wonder what percentage of faculty and staff believe it's a priority. And I think if you just look at your campus budgets you can tell where the priority is, because go where the money is, and that'll always tell you where people's heart is. I'm joking, your heart can be in other places, but money drives a lot of decisions. So you have to be an advocate in that space. Education is huge. We are essentially higher education professionals, right? With education being at the core of what we do. So why not have health and well-being and how we deliver it be essentially grounded in education as well, not just treating students from a term-based clinical care model, but also educating them in turn, so that way they can make more informed decisions about their health at this point in their life, but also well after they graduate. I think that's what's so important about this framework, is that it not only addresses impacting health outcomes right now, but we're also talking about engaging and improving students' health-seeking behaviors. And that's essentially what this is about. How can you engage your students' health-seeking behaviors, so that way you're not telling them, don't do this, don't do that, eat this, eat that, do this, do that. No, you're not going to change most 18 to 24-year-olds behaviors by doing that. But what you can do is you can give them all of the information that's available, all of the factual information that's available. So that way they can make more informed decisions about their health today, but also when they graduate. Now, this not only becomes a habit during undergrad and graduate years, but when they get older, it becomes a behavior. So now they're making more informed health decisions as they get older and go through life. Student-centered collaborations is key. I talked about that a little bit earlier, making students the center of everything you do. That was something that really stuck out during our conversations with this CUNY staff, was that they engage with students on a regular basis. They oftentimes, it was referred to as the students being their babies. They really saw these students as their own. They really took care of them in that way. Because especially in a dense urban environment like New York City, where there's a high level of poverty, and students have to travel far distances, and there's a lot of students that come from marginalized and underserved communities, the need far outweighs and exceeds what a lot of student health and well-being departments were able to provide. So a lot of times these professionals were coming out of their own pockets. They were having to advocate. They were having to work after hours to really meet their students' needs that far exceeded just going to the doctor and getting a prescription for a cough or for an STD. And then decisions rooted in health equity, I think, are so important because this past year, I think, has shown us, or has really exaggerated the disparities that exist in this country from a racial equity standpoint, not just with the social injustice issues that have been impacted over this past year from just some of the unarmed killings of African Americans that we've seen play out over and over and over and over and over again on TV, to just the disparities that happen at our border, our southern border, to even just going to the disparities that have been exposed during COVID-19, where a lot of our immigrant populations and individuals from communities of color have been impacted at higher levels by COVID-19 while still having lower vaccination rates. Individuals from minority communities that have been impacted from a socioeconomic standpoint because of COVID-19, with losing their jobs, being displaced, not having access to testing or vaccination early on in some of their communities. So it has really just exposed, I think, the disparities that our students of color, our first generation students, our students with disabilities, our LGBTQ students, all of those students that present from these smaller groups on campus, are these more special populations, as some people call it on campus. But having your decisions rooted in health equity are just so important. And notice I say it not incorporating health equity into your conversation. I said having your decisions rooted in health equity. That means that the conversation starts from an equitable standpoint first. And I think that's the mistake that a lot of universities are making now when they bring DEI experts, or they hire professionals in the diversity, equity, and inclusion space, was that we try to take this archaic idea and we try to implant ideas of equity, diversity, and inclusion. When in actuality, you need to scrap that whole thing and have your decision rooted from an equitable standpoint. So that way, everything that grows out of that foundation or that root is from a health equity standpoint. See how that works? When you start from a place, everything else is going to be grounded by that idea. And that's what this framework is. It's really a foundation for where you start. And then you take these principles on here and you make them applicable to your university and your student population. And then, of course, we can't have a conversation about health and well-being without talking about public health. And how our public health from a community standpoint, from a campus community standpoint, has been significantly impacted over these past years because of the pandemic. So that's essentially the framework, when we talk about the data that was collected, how it was analyzed, interpreted, this is the ultimate result that I want to really drive home today, and to be the takeaway messages. How can you take these 6 principles on here and really examine or assess what does your health and well-being department or unit look like on campus now? Are you already working in these spaces? Do you have elements of these pieces already a part of your campus health and well-being structure? Are you missing elements in this space? Well, if you are, the good news is that here are some amazing ways you can implement some of these things on campus. Because where do I start, right? That's the age-old question that people talk about when we see these amazing frameworks and toolkits and white papers that come out. They sound really great, but if you're like me, you're wondering, like, where do I start? Okay, all of that sounded great. What you just showed me in this framework, the colors was nice, you had a nice little graphic. Where do I start? Where do I start as the assistant director of health promotion on a campus in Alabama, where we have limited resources and we have 6,000 students? Where do I start? Where do I start if I'm a assistant vice president of health and wellness and I'm trying to develop a new idea or a model for health and well-being on my campus and get buy-in from seniors? Where do I start? So again, I mentioned 2 areas I really want to focus on in this conversation today is advocacy, education, and outreach as ways to start, as well as the health equity piece. And again, I'm going to kind of go through these just a little bit quickly, but because I want to leave a few minutes at the end for us to have a conversation and for me to answer any questions. But where do I start from an AEO standpoint? Well, the first place you can start is to conduct a community health assessment. You have to understand what is the idea or what are the outcomes and what are some of the biggest concerns from a health and well-being standpoint of your campus constituents, i.e. your students, and not just your students. Again, you don't want to miss faculty and staff in this conversation because they are a big part of the drivers or those arms for your advocacy and your outreach, because you as a healthcare professional, your staff that are in this space cannot be the only ones that are focusing on this work. It has to be a collective agreement across the campus. And that's how you really change and impact from a community standpoint. And that's what this framework is about. It's not just about doing amazing things within your 4 walls of your student health center or your campus rec center. It's about extending that and making health and well-being a priority. So we moved at 51% that students believe is a priority to about 80 or 90. I'm good with 90. 100 is perfect. Nothing's perfect. Health is a cycle. We're on an endpoint. But if we can get to around like 85, 90, that's at least a B plus or A minus. If we can get that 80% of students are believing that health and well-being is a priority, I think our work is done. We can all say we finished and wrap it up and all go sit on the beach. And that's where we have our conferences at in Hawaii. So Dave, by the way, that's where the next conference needs to be, somewhere tropical. So just put that in your meeting minutes. But establish a task force to discuss these advocacy, education, and outreach efforts, and path for ensuring health and well-being are central. Again, AEO efforts are not just the work of health and well-being professionals. This task force is a great way to engage those staff and those faculty members that aren't in this space on a more focused and intentional way. Instead of just having webinars and bringing them to meetings, create a task force where we all can play a part in this and make sure students are included in this. Create regularly update an online database of community resources that support social determinants of health. And then lastly, of course, like I said, partner with faculty to create or refine health and well-being resources and determine modes of delivery to students. Those last 2 are directly speak to the outreach and education piece. Again, your online presence is almost more important than your actual in-person presence. And I hate to say that to the folks that don't use social media, that think TikTok is a candy bar, that still have a flip phone. And no disrespect, if you have a flip phone, they're very durable, they're small, compact. But that's not where our students are. Our students spend the majority of their day on a mobile phone, on some type of social media platform. And if you don't find some way as a healthcare professional on your campus to use that model to engage with them, you're never going to have a conversation with them. You can send 1,000 emails. You can have your president write beautiful letters with a nice letterhead on it. I mean, these letterheads are incredible that come from the president's office, but students don't read those. So you have to find ways to engage with students from an online social media perspective. And again, the area that I said I really wanted to hit on was the AEO, advocacy, education, and outreach, and also making sure we talk about health equity and how your decisions should be rooted in that. And not just because I think these are 2 important areas, but again, out of the conversations that we had with our staff, these were 2 of the things that seemed to stick out the most. It was ability to outreach and engage with students was referred to a lot, our lack of a social media presence, our lack of a website presence, and then again, being able to engage with diverse groups of students and making sure that health equity is at the center of everything we do, from not just engaging from a health and counseling standpoint, but how do we support housing and food insecurity? How do we support well-being and belonging on campus? How do we create these safe spaces for students that haven't always seen themselves in the majority population? And that's what health equity, our decisions rooted in health equity, are really about. And I think there are tons and tons and tons of resources that are out now. NASPA does an amazing job. NIRSA, ACHA, all of the partner organizations on this call, as well as others that are in this space, do an amazing job and have done an amazing job of presenting resources that are available online through their websites to support how you engage and deliver health equity, or how you talk about health equity, especially racial justice. Because again, like I mentioned, I think that's really the center of a lot of our conversations that are happening on campus right now. So these are just some recommendations of ways that you can implement health equity, or start the conversation around health equity on campus listed here. And again, this is a presentation, but there's a document that is available through NIRSA, has it available on their website. And I think, I'm not sure if ACHA or NASPA have them available, but the complete document, the complete framework is available. It's like a 15-page document that really dives into everything I'm talking about today. So not just listing the recommendations or principles here, but there's a checklist involved. There's recommendations for the future. There's more data. So I encourage you after this conversation to really go out to those 3 different places and really try to access this full document. And I'm not sure if NIRSA or Dave, if you all are able to make a link or anything available to this full document online. So out of that conversation, those 2 elements I just mentioned that we did a sort of a deeper dive into, these are 4 pillars that I think, again, out of the conversations that we had with our participants, as well as the lit review and just an overall developing this study and this framework, these are the 4 central pillars that came about with elements of a comprehensive college health program. And notice I said college health because I wanted to make sure, that we included student health services, counseling and psychological services, campus recreation and wellness, and then of course accessibility, depending on your campus, sometimes is included in that portfolio as well. But these are the 4 central pillars that again support the foundation of this framework. So if I was building if I was planting a tree, for example, these pillars are these elements right here would essentially be the soil, right? This would be the soil. The framework is the tree that's planted into the soil, that grows out in the roots and comes into the soil right here. So these are the foundation of what your college health program should look like. It should be integrative, equitable, collaborative, and again, student-centered. And it might seem like I'm starting to sound like a broken record where some of these things are kind of flowing together and all kind of connecting, because it is. These are the elements that no matter what campus you go to, no matter what your population looks like, no matter what type of college or university you are, these central themes right here, from those principles, a part of the framework, to these elements right here are key. I mean, just important, the utmost importance to ensuring you have a comprehensive college health program that results in all of the amazing things that we see some of our partners across the country that are doing right now. So I'll just leave this here for a second, just for you all to take a look. But these are the 4, I think, central elements that are the foundation of every college health program across the country, and should be the foundation for where you start. These 4 key buzzwords should be included in every mission statement, vision statement, proposal, document, white paper, funding requests, you name it. If you're trying to get more resources for your campus, for your college, if you're trying to work on the quarantine and isolation space, the infectious disease space, these 4 words, these 4 principles shall be included in everything you do that's delivered from your health and well-being space on campus. Thank you, NIRSA. I see they just put the final report in the chat box, so I encourage you, please download that. And again, my contact information is available at the end of this, and I would love to follow up and connect with anybody that has questions, feedback, wants to bring elements of this to their campus. Please reach out to me. But as I close out, I did want to focus on future trends. So I wanted to give you all an idea of what we also learned from our one-on-one interviews. And I'm pretty sure that I put future trends in CUNY Health Services, because this is what we determined from our conversations. But again, regardless of the campus you're at, regardless of the region or country you're in, I think these are our central elements that we all can agree are future trends that we have already started to address, or you're going to have to make sure you have some type of comprehensive response or process or initiative in place to support these elements. And of course, telehealth services and expansion of it, that's not going away anytime soon. Public and community health focus. Again, there were essential elements on our campus. We might have had 1 or 2 policies somewhere. We might have had to knock the dust off of it and figure that out. We had to hire people. Having a centralized idea or a department that focuses solely on the community health of your campus is without a doubt one of the most important things you can take away from this conversation and from this pandemic when it turns into an endemic and we aren't in this space where we can focus our work on other areas. But there's gonna have to be a focus on community and public health on campus because this isn't the last pandemic that we're gonna see. Hopefully in our lifetime it is, but I think elements of COVID-19 will be here for some time now, whether it's an endemic, like I mentioned, whether we treat it like the flu every year, where we have booster shots that are required, whether there are students that are still catching COVID-19 and experiencing symptoms, or this growing area, population of America of long haulers, right? People that have experienced COVID-19 and are still experiencing symptoms of COVID-19. Our students fall into that category as well. And I put emotional well-being focus at the center, because again, I think this grounds this work as well. There has to be a focus on emotional well-being because the pandemic has impacted us all, not just from a physical standpoint, but also from an emotional and psychological and mental health standpoint. Social determinants of health go right into that idea of health equity. And then of course, health information advances, how we engage with students from a virtual health information standpoint and how we're sharing information, right? That's something I didn't really dive into, but how well does your student health center talk to your counseling center? And how well does that counseling center talk to partners off campus? A whole nother conversation. But again, I want to thank you all so much for this opportunity. Out of all of the work that we do on a day-to-day basis that is difficult and challenging and stressful, being able to share this space with you all and talk about health and well-being brings me joy. So I hope this was insightful. Hope it helped you out. Hope you were able to take away something. I threw a few jokes in there. I put Dave on the hook to have us go to Miami or Hawaii. And y'all got it. NASPA got it. Y'all, I seen the budget. Y'all got it. I'm joking. I haven't seen the budget. Thank you all so much. I put my contact information on here. Please feel free to reach out and I will stop sharing my screen now. And I would love to engage with you all. If you have any questions, comments, anything, let's talk.
All right. Well, Micah, thank you. First of all, thank you very much. This was both very exciting to hear you go through. And then, of course, as one of the early readers of the report, I'm so glad that we have this out as a resource for the field. We've got some questions in, and I wanted to go ahead and take a chance to go through some of these. And then I also have like pages of notes that I have some questions of my own. But to get us started, when you think about the CUNY WELL framework, is there, it's student-centered, which is fantastic. And I think it's the reason we all do this job. But is there some way to apply this to faculty and staff well-being as well? Is there some means that this can be whole campus-wide?
Yeah, definitely. That's a great question. And that was actually came up in some of our one-on-one conversations because I think, and that was one of the main reasons actually why we focused the interview population on staff members, right? Because we could have had students respond to this and probably develop equally valuable framework, but that was intentional for us to get the perspective and perceptions of these people that are in this space, right? Because not only do they have the expertise and understand from a, psychological, physiological, all the words you want to use type of standpoint, but also they have that lived experience of seeing the inadequacies or the gaps that exist in being able to deliver these services. So I think it gave us a unique perspective in really seeing the people that work in this space on a day-to-day basis, and also hearing from them the gaps that exist and how we can further improve that. And some of the things that came out, especially when I'm looking at the principles, I think the advocacy, education, outreach piece is probably the best principle that I think can be applied to the faculty and staff side. It's something we learned with, especially those that are engaging students in the mental health space. It can be daunting, like it can be a very daunting task and daunting responsibility. And one of the gaps that came out was having a person on the senior level, whether it's in the human resources space or whether it's on the president's cabinet, that has this sort of health and well-being kind of background. So the chief wellness officer, which is starting to evolve now at a lot of larger universities, and those are conversations that a few systems are having now. How do we have this sort of senior level leader that has this sort of campus-wide influence over health and well-being? So not just focus on the students' health and well-being outcomes, but also faculty and staff. A model that exists really quick is Ohio State. they have a chief wellness officer, and they have health and well-being for students, and they have a huge portfolio that supports health and well-being for faculty and staff. And those units don't all report up to the chief wellness officer, but this person plays a very intricate role in ensuring that resources are available across the board for all. So I would say the biggest area that I think is that AEO space that can be applied to faculty and staff, and really focusing in on, depending on your position on campus, what that senior level person would look like. And if that person isn't available as far as resources, how can we go back to this sort of task force idea or this committee where we now as a committee influence health and well-being for faculty, staff, and students?
Yeah, thanks, Micah. The discussion about a designer is going to be really important to us as we get into some of these other questions. But a quick plug on the CWOs. Bill Fox's work from Denison around the role of the CWO and its growing prevalence. Would love to give a shout out to some of Bill's research for anyone on the call who's not familiar with it.
And I apologize to my Penn State family for mentioning Ohio State. Normally, I wouldn't have done that because I've been playing them in a couple of weeks. So all my Penn State folks, I apologize. There was a slip of the tongue. I should use another school.
Yeah, that's most of the chat right now, actually. Mike.
Yeah, I'm starting to I see the angry faces coming in and the thumbs down. So I apologize.
Well, talking about design, when it comes to thinking about these pillars as maybe areas that we could measure, where does the responsibility for measurement lie, and what sorts of things should we be looking for as sort of goalposts to be aiming for on these?
Right, and that was another area that I think was intentional, was that this, as I mentioned at the beginning, the work from this framework is, I don't want to say funneled, but it is streamlined through your student health center. So the concept that the student health center is essentially the central place where a lot of these ideas generate from. And that doesn't mean that the student health center is the owner or the governor of each one of these principles. That just means that that's the center where everything should begin from. And again, this was a collaborative, and I think I used that word probably like, I think I counted. I think I took a sip of coffee every time I said collaboration. But collaboration is the key to this, and it's student-centered collaboration, but it's also the idea that a campus is a community, which means that we all play different parts in this. We are all equal stakeholders. And as we all know, when everybody plays a part in it, we all equally involved in the outcomes that result in this. And I hope that that picture was painted, but that's essentially the idea behind this, is that the task force, for lack of better terms or words, if you don't have this kind of senior level leader, that this task force makes these recommendations. And the full report that was provided in the chat box, when you look in it, there's some recommendations on there that talk about how you engage with different groups on campus and how the task force sets priorities for each department, right? So it's not the student health center as the data collectors, it's your research and assessment. And how can you engage them? How can you engage data sets that are already out there? ACHA has the National College Health Assessment, which is a great tool that's available that looks at campuses across the country and how you can benchmark your data on your campus against what other campuses are doing. So if you don't have the availability or the resources to conduct a full spread assessment, there are resources out there. But I would definitely encourage you from an assessment standpoint to really engage with the departments on campus that are doing that. And if you don't have an assessment department, another great way to engage faculty, engage those faculty researchers that might be doing research in this space or might be interested, engage them on the data collection and assessment side. So that way now they are the owners of the data set, and you as the staff and healthcare professional are the person that implements that data. And now you have this partnership, because one thing I learned about faculty is they love writing, they love researching, and they love getting grants. They love a grant. So why not partner with a faculty and allow them to kind of do that space? That answered that question. I feel like there was another part in there.
There was, if you had any thoughts about what we should be measuring. And I know that that's an evolving conversation. Yeah. And I know it's something we'll be talking about in January. And I think NIRSA will be talking about at their event, and probably ACHA and following in the summer. Like, I think what to measure is going to be a constant conversation. Yeah. But if you have some initial thoughts, we'd love to hear them.
Honestly, I think your student population is going to drive that, right? Because if I don't want to use STDs because every campus has STD problems. It's not a good example. So if travel health is not a priority in your campus, then you probably don't need to assess how effective your travel health policies are. And again, as a community health person, the first thing I do in any situation is a community health assessment, right? Now you have to assess what are the priorities on your campus. The data I used here to create this framework was the priorities that presented on CUNY's campus. CUNY being a university in New York, is going to be completely different than the University of Florida system in Florida. But what you can do is assess the biggest needs on your campus, and that data will drive what you do. A lot of times, especially in the health promotion space, they focus on outreach and the tabling and the programs and all the amazing things on campus. And then if you develop a program and 2 students show up, you go back to the table and you're wondering, we did this amazing thing. We had this music and the DJ, we had free pizza. The student, they don't want no pizza. Maybe that was it. Maybe it was the music you selected, or maybe you just didn't ask the students in the beginning, what do you want to see? And I think that's what's missed a lot, is that when we develop programs and outreach, we don't know, one, the model of how to deliver it, because the best way to engage students, but also what are the health priorities that's important to them. And I think that's something that's missed. So engaging students, knowing what the priorities are on your campus, and knowing what the community engagement and involvement level on your campus is will definitely lead you to a direction of success.
Yeah. In fact, this is a great opportunity for me to ask one of the things that I was thinking about when you were talking about changing behaviors. I'm always so interested in this. So I'm going to start with a question about some of the interviews that you did. When it comes to changing behaviors, we've got clinical approaches, we've got the indicated approaches like you just talked about, where we bring pizza and a DJ out. And then we seem to really want to be moving towards environmental approaches where we actually change the design of our campuses, especially those, as you mentioned so aptly, are rooted in equity work. What's the sort of tolerance or interest of the folks you interviewed to moving to an approach like this?
From the health promotion side, I think the 3 health promotion staff we engaged with, they were 1,000% on board, because they most of the time were involved heavily with the Office of Accessibility and Disability Services, depending on how it's named on your campus. They were involved heavily with Title IX from a counseling standpoint. So to see the environmental structure of campuses change was on the top of their list. And that was something that really stuck out, especially with some of the campuses. So for example, we interviewed someone from the Borough of Manhattan Community College, which is centrally located right in the middle of Manhattan, literally a block from the World Trade Center. I mean, right in the middle. So think about that student population, and they're coming from everywhere. Some of those students are taking an hour train ride from Queens into Manhattan. So think about an hour commute. Think about them not being able to drive. Think about those students coming from that lower socioeconomic background statuses. So it was just a very unique environment that these students had to transcend just to get to campus. So a lot of these professionals in this setting weren't just advocating for campus environmental changes. They were engaging with the city. They were engaging with the metro transit system, so we can improve accessibility with using trains to get to campus. And that's what I think is important. The takeaway here is how you engage from an environmental justice standpoint is not just central to your campus. How does the city community around your campus, how does the city council, and how do they vote on things on campus? How accessible are your hospitals? How available are your eating disorder clinics off campus when you have to refer? So how do your community partners, and how are they set up? Because again, like I mentioned, we are designed for term-based care. From a counseling standpoint, from a health standpoint, even from a campus rec standpoint, this stuff is term-based. It's not meant to just go on and on and on. So when you talk about accessibility and environmental standpoint, you have to look at how you engage in those resources on campus, but also how are you engaging and how are you advocating for those resources off campus? Because in all likelihood, the overwhelming majority of students will have some experience with the health resource off campus during their tenure on campus. They won't just be situated to your campus.
Yeah. So Micah, that ends up with a lot of the conversations I've been having, and some of what I've seen in the chat and the questions is there's excitement about environmental design. But what I remember from being on campus, it's been a little while, but then it's National Collegiate Alcohol Awareness Week, and you got to go do your table for this thing, and then it's Eating Disorder Week, and you got to do your table for that thing, and we chase sort of topic by topic in order to fill out a calendar. Because that's sort of a model that exists within other departments that don't necessarily have this same focus on well-being. What can leaders do to break this, to make time available for that environmental intervention? What can we do for each other to keep ourselves accountable? How can rec, health, and student affairs work together really to get ahead of these issues?
Yeah, definitely. And again, you hit it right on the head as part of your question. And I'm glad that the even idea of this was an inter-association agreement, because ACHA can't do it all. Campus health services can't do it all. Counseling services can't do it all. Student affairs as an idea, as a process, as an organization, as a unit can't do it all. Campus rec can't do it all. but each one of those areas plays a unique area of expertise and value. But the problem is, as you probably know, we work in very few silos. Campus self-services is doing this thing. Campus rec is doing this thing. And we rarely see how these areas can intersect and cross over. I used the example before when I was talking to a group of students. The way your campus and well-being departments and services are set up on a campus now, that experience will never exist once you graduate, right?
Right.
Counseling and behavioral services in the private sector that we engage with, usually not in the same building as your campus health services, right? You probably aren't going to get an appointment the same day. Your campus rec center is usually not within walking distance of your residence hall where you live at, right? And membership, I don't know, last time I looked at the YMCA, they say they're a charitable organization, but the membership is not cheap. Even to buy access to exercise is becoming an entry point from an equitable standpoint, but I won't go down that road. When you see how much a Peloton costs just to get a bike, just to be able to burn calories, you got to pay an entry fee. Campus rec on campus rec, the experience that students have there from an intramural standpoint, from an engagement, from a leadership standpoint, that's often missed is student leaders that take on jobs in campus. Those health promotion experts, those health educators, that centralized ecosystem of health and well-being as we design it on a campus, whether it's integrated, whether you feel like it's not a priority, whether you have one nurse, there still is some idea of campus wellness, campus health promotion, all of the buzzwords, centrally located where students have, for the most part, easy access to it. Once they graduate, once you get out into the real world like us, that's not how it works. Even engaging a student health center is not how it works. So I'm saying all that to say is we have a very prime window. We have some of the best resources, some of the best facilities, some of the larger, best, most reputable organizations all working on this right now during this 4 to 5 year period that our students are on campus. Depending on the campus you're on, you might have some great resources. And we have the ability to use these resources to engage with students, not just to get them to come to our events, but like I mentioned earlier, how are we changing the health-seeking behaviors of students? So that way, if they go to the bathroom and something's burning, they don't wait for 4 days to go get a test, right? Or they fall and get a knot on their head. They don't wait until they passing out to come see anybody. Or now you're in the point where you're sitting in your room shaking and having an anxiety attack, but you were having anxious feelings last semester. So how can we engage and get them to use these health-seeking behaviors? Because that's what's important. Because last time I looked, it's not a whole lot of people doing table and exercises in the community for adults. It's not happening. But that's the resources and that's the design that we're using now. But that's not for the lifespan of an adult. That's not the experience they're going to have with engaging with a health and well-being resource. So how can we duplicate what's out there, but take advantage of the resource and how it's structured right now to teach students these health-seeking behaviors that they carry well after they graduate and know how to navigate this U.S. healthcare system.
Yeah, Micah, listen, I have 100 more questions and there were a couple I didn't get to, but we are at time. So I'm just going to, again, thank you very, very much and encourage folks to add their thanks to the chat while we wrap up. Again, this learning opportunity was part of the Inter-Association collaboration, but was gracefully sponsored and hosted by NIRSA. So thank you very much to Aaron O'Sullivan and to NIRSA for providing the platform for today. Micah, thank you very much for the research that you have done. I look forward to continuing to hear about it at a couple place-based events. Yeah, I know Boston in January, not exactly rolling your socks up, but the other events that we've got going on across the country, I think some warmer locales to come. I believe San Diego maybe this summer as well. So thank you very much to Micah. Thank you to all of you for joining us, and we look forward to engaging y'all in some additional conversation about bringing well-being design to your campuses and making this a sustainable future for our students. Have a wonderful rest of your day and be well.
Thank you.